everybody. Welcome to Meddkit's Provider Spotlight, where every week we are coming to interview the most amazing private practices from all over the United States. Every week we come with someone with a brand new perspective, new specialty, and we're just so excited to learn from the amazing people that we have the pleasure of sitting down with. So today we have an awesome and very special guest for you. Really excited to introduce you to Dr. Mark Sylvester. He is the owner of Mind Body Medicine of Florida and also Vesta Chelation method, where Mark and his very specialized team can virtually see you all across the United States. So welcome, Dr. Mark. We're so excited to have you.
Thank you for having me. I'm excited to be here among the awesome.
I agree. We have a lot to dive into, so I will start us off with, would really like to know, and I think everyone else here would too, is your background. You have a very interesting one, but would also really love to know your why, like what had inspired you to open up your practices.
Well, great kickoff question because I think I'm a little bit unique in that regard in that one, I was an engineer before a doctor, and engineers are wired a little funky, if you know what I mean. More root cause oriented, big picture oriented, which precisely is what medicine needs. What was interesting when I started medical school is I realized none of these kids thought like I did. Didn't reason the way that I did, didn't have a desire or hunger to know the why behind not just illness, but the mechanisms of the body itself, maintaining wellness. And that was the template I went through all of my training with. And ultimately, at one point in my career, got sick myself with a functional medicine issue that my allopathic colleagues had no clue how to identify, detect, treat, or even really believe in. So I was left kind of high and dry. Necessity is the mother of invention. I found a really great functional doctor. Love the way they approach illness and health, and the person, not treating people like a disease, is a big part of it. And really just started down the rabbit hole of learning a whole new medical approach and way of addressing illness and treating patients holistically, completely, mind, body, spirit.
I love that. I love how your why is actually the question that you have been trying to answer um, for a very long time, and getting to the root cause and to the truth of it all. It's like, a little kid that's like, well, why is this like this? Why is this happening? And that has, it seems like that has been you across your entire experience, not just as an engineer, but you like to ask the questions to fully understand a problem.
I am a little kid in that regard. Yeah, why was always my first question. And then I realized doctors don't ask that question,
Yeah.
not just first, but last. They never ask that.
Mm.
And if you ask them why, they often get unsettled, irritated,
Yeah.
just give you like, well, just because, or don't ask why, or we don't know, or they blame you, right? Oh, or genetics that rather than something that resonates like the truth. And people, thank God, finally are waking up,
Yeah.
especially after the pandemic, because we saw the first world country during a global pandemic totally flop on its face
Yeah.
and threaten doctors and these awful outcomes and ICU lockdowns and really doing very little but supportive care and running out the clock before they stuffed you in the body bag.
It it's going on now 6, almost 6 years, was a wild time, for sure. And I think, maybe this is our theme of the conversation of why. I think, you know, we a lot of us in healthcare started to dig into why are we doing things this way, and people started to really care about, not that they didn't before care about their health, but I think have became very invested in it. And something that I think everyone would appreciate knowing here is, what you help people with, like what is the why behind, what you're doing, how you're helping people. There's, I'm sure, a lot of common things that people are coming to you with, but I think as, kind of getting into the functional medicine side of things and people are opening up their eyes, I think there's a lot of uncommon things that people aren't quite aware of yet? And what are all the things that you can help someone with? And from provider to patient, just may not have an idea of what the full spectrum of all that is.
Yeah, I mean the pandemic created a lot of what I called medical refugees. These were people that knew there was something wrong, were desperate for treatment, were medically gaslit, still have this brainwashing of, well, I got to go to my all-knowing, all-powerful doctor for the big pharma solution, which will make me worse
Mm.
sometimes. And they started thinking for themselves and they started self-directed care and they started taking more initiative and responsibility. And
Mhm.
what you find out is we're sicker now than we've ever been. Why? That's my first question. Why? Why don't we talk? If we had this conversation 40 years ago, you'd say, well, I know one kid in my class with asthma. Well, you probably weren't alive 40 years ago, but and now all these kids are obese. They're sick. People have all these chronic illnesses. And the big why behind that ultimately is the body's overwhelmed. It's overburdened. It's overburdened with stress. It's overburdened with carcinogens. It's overburdened with toxic food, ultra processed food, additives, preservatives, dyes, chemicals, pharmaceuticals, um, uh, uh, pesticides, atrazine, glyphosate, and the list goes on, heavy metals. So, what I see is people getting chronically ill,
Mhm.
the allopathic. I've got this great meme over here. The top shows a lady in bed that says something's seriously wrong. And then the next frame, she's in a coffin and her doctor's standing over her telling her her labs are normal. And that's a perfect summary of that healthcare system. So people are going to their doctors, they draw basic, silly, stupid blood work. Well, it's all normal. You should go see a psychiatrist. It's in your head. And what we're finding out is there are people that carry on these chronic conditions. COVID was actually one of them. And I'm very surprised that our system recognizes long haul COVID because it's no different than any other long haul syndrome, whether that's fibromyalgia, chronic Lyme, mold biotoxin illness, chronic heavy metal burdens. They accumulate, they slow down the normal functioning of our system. We have this really complex biochemistry that we all are born into the meat sacks and take for granted, but it's an absolute miracle what it does and what it's capable of doing, even when weakened or vulnerable. You can remove the toothpick that's sort of dropped in the biochemical pathway, and nature is always working towards healing and restoring the original state. So, a lot of what I do is root cause analysis, root cause illness, open-minded investigation, seeing multiple variables at once. Doctors are extremely myopic. I say they're expert technicians.
Mhm.
Um, but these, if you made a car analogy, a technician can change your tires. Usually they show up after a crash. They pick up the tire that passed you. They're not the ones that designed the car. They're not the
Right.
ones that installed the tires. They're not the ones that thought to check the lug nuts. And that's one thing that I see shifting is people don't really trust their doctors. They don't really have a primary care that should function the way the primary care was intended as a gatekeeper to your health.
Yeah.
Managed care even tried to push that. Like they won't let you see a specialist, but primary cares are just outpatient internists.
Hmm.
What we need are functional, integrative, allopathic, informed, but holistically trained as well so that they know what shape of the tool that's needed for the job. If I need to send them to primary care at that point, or I need to send them to go get a statin, fine. Well, most of the time, if you're integrative, you can do all of that yourself. So I think we're giving birth to this whole new field of what I would call the new primary care that really can understand big picture, everything that's going on with you.
I agree. Like, I feel like people are starting to wake up. And you mentioned this, yes, we have like grown as a civilization, and what has happened 40 years ago is different now, but it's weird that yeah, our bodies are very overwhelmed with what's happening, environment included. And you think because we've progressed so much that our health should go in that same trajectory. And
Yeah,
it's the opposite,
exactly.
right? Like there's so much resource, there's so many other things. And I think now people are now starting to understand, oh, I've heard about functional medicine, or I'm interested in it. There's other things I should be looking out for in my health because of the overwhelm because things have shifted and we're waking up to it. And so I'd love to hear from you, like what are some, like also in your practice, like the modalities and maybe certain tests that you're using that are for you like yielding the best results, but has been really helpful to getting people to this next stage. Now that they're interested, they know what you can do for them. Like what are some of those things that are just different than what other
Well,
people?
that's a great question. I'd say probably the biggest ones is even just starting with basic blood work.
Yeah.
When you go to your primary care and they do an annual physical, they're
Mhm.
going to usually do a CBC, a CMP, and like a thyroid panel.
Yeah.
Okay, that's bare minimum. And I'm not about wasting healthcare dollars or just stabbing in the dark. But if you're going to screen the thyroid, do a full thyroid panel. So often thyroid disease is missed because the basic screening, which by the way is done by endocrinologists and OB-GYNs and advanced specialists, it's inadequate. It's almost not worth ordering. It's a tiny piece of the puzzle. So there's a lot more we can do in just basic blood work.
Yeah.
That's not most of what I do, but let's say we're looking for mast cell activation or chronic inflammatory markers. You can pick a lot of this up in the blood for the cheap. Health insurance doesn't, of course, cover some of the more exotic testing like intracellular testing or even just a GI analysis like GI effects or nutri-evals where they're taking blood and urine, or we do a lot of urine mycotoxin testing. And I'm in Florida, so since we had a really bad hurricane recently, we have a lot of water damage buildings, structures, hospitals, schools, and of course homes. We've been seeing a lot more mold biotoxin illness, so we do mycotoxin testing. We do hair mineral analysis for heavy metal testing. We can do advanced, tick-borne Lyme testing. So just more specialized functional tests,
Mhm.
which are much better than their allopathic counterparts if they're even available, which stunned the crap out of me. I'm an engineer. I'm born with the left brain and loving science. And I'm thinking, how unscientific is this allopathic approach? I thought this functional world was going to be all crystal rubbing and hooey Birkenstocks. It's the future of medicine, and it's so good to see people finally saying, no, this is unacceptable the way we are doing things. I know there's something wrong with me, and I'm not going to give up. And I tell people it's just like going out to eat. You don't go to a bad restaurant with lousy food and it's overpriced and the service stinks or whatever. You don't swear off eating. You just don't go back there.
Right. I mean, it makes total sense. And you made me laugh because I think like and we'll get into misconceptions, but I think because of your interesting background, and I do want to point out, aside from, being an engineer and, and doing all of this as well, you have six certifications, right? So I think, you are specialized in so many different areas. And I'm sure that has shaped a lot of your viewpoints on how you view medicine and your approach. So I would love to hear how those things have impacted you. And I'm sure it impacted your patients in a very positive way because you can really see things from, I think, different perspectives than other people can't just because they just haven't stuck their foot in it.
I think what makes me different is I watch how hard doctors work. I watch all the barriers to care that they have to navigate. I kind of understand why they are the way that they are. I was surprised going through the old Rockefeller allopathic training module that I got similarly brainwashed the way that they were really until I got sick. That's finally what woke me up. I'd always had an interest and a penchant for the functional. I watched my mom go through cancer very young and get third time metastatic with macrobiotic diet. And they basically, our system sent her home to die. And she's still alive and kicking and attributes it to that. So I've always been open to it, but very, very comfortable in the left brain. So I think I brought my left brain into that world. Um, but just watching how the system fails people and years they will go with a chronic illness that is not detected, not found, argued against. They get frustrated. They by the time they say me, they're pretty hopeless and helpless, and they're really surprised. They said, you treat me like a person, and I'm thinking, what does everyone else treat you like? That's
So
awful. So I have learned like the cone of knowledge is essentially the more as you go up it, the more you know, the more you realize you don't know. And that's been my experience. I get bored and burnt out with doing what the regular docs do because they stop thinking. It's very medical legal, run a test. If it's this result, go on the list, pick this treatment, pharma always or an antibiotic for a virus. They do a lot of things they know they're not supposed to, but it's really they're crushed with time and they have zero energy left to learn anything. I am wired completely backwards. What sustains me, like Trinity says from the Matrix, it's the question that drives us. So I am constantly learning and wanting training and wanting to understand more so that I can either have that knowledge itself as we understand it or hypothesize with my allopathic or osteopathic or engineering brain to try to take my best guess, which absolutely should have been what all doctors did during the pandemic. It's a global pandemic. Let's pause and consider thinking outside the box for a second. But,
Mm.
talk to a hospital about giving a patient vitamin C and they called it malpractice. The whole ivermectin conundrum, and the Department of Health threatening our licenses almost on a weekly basis, by the way, pharmacists reporting we already have about 400 people in this chair, behind me that are trying to kill you. And it's sad to see the system itself and the design of it be its own barrier to care. So that's what I'm hoping that the more we know, the more open-minded we can be and more we realize how much we don't know because doctors are often wrong, but always sure.
That's a very interesting perspective. And I think it's really sad that a lot of people have to go through life being not heard by the people that had taken an oath to really care about taking care of them and to do their best and to, you know, all of those things. And so yeah,
Not heard, but also they're not cared for
yeah.
and they're not cured.
Yeah.
It's supremely depressing. I
0 out of
it's
2.
It's horrible.
Yeah.
And you when you said, "Hey, you made me laugh." Hey, laughter's one of the things I have on my prescription pad. It's an important medicine now more than ever.
Mm.
The pandemic created this creepy psychological distancing, which effectively was don't make eye contact with me or you will kill my grandmother. And a lot of that is still continuing on. A lot of that fear residue, a lot of the chronic stress, cortisol driven, sympathetic overdrive, that has a toll on our immune system, that has a toll on our brain, our body, our nervous system. And guess what? That's the root cause of a lot of illnesses. Antibiotics don't treat that. Antifungals don't treat that. HIV meds don't treat that. There's a lot of Western medicine that is the tool that's needed for the job. Like if I'm, run over by a car and the bone's sticking through the skin, I always say, don't give me tea tree oil, take me to the orthopod. But conversely, we see a lot of the opposite. I'm seeing 30-year-olds on statins. We've never studied what a statin does to somebody for the rest of their life. There's concerning evidence that long-term use can lead to dementias and dissolve the actual healthy cholesterol in the brain. Um, Hormone replacement therapy. I mean, the list goes on and on of all of the mistakes we've learned. So it's pretty arrogant to think that we know better than Mother Nature. Any treatment, for me, my philosophy is always to facilitate the impasse, find where the toothpick was dropped, find why the body got derailed, chronic stress. You know, we have a strep little epidemic going on around here, and that's a nasty bug. I'm going to be more inclined to favor an antibiotic earlier on and something like that than I am a viral illness when I know it's not going to help. I stop and I take the time to explain to patients why that's not the right treatment and why that can actually make them worse. Most people don't know the side effects, and they're never explained to them of basic things like statins, proton pump inhibitors, or H2 blockers. These are antibiotics are a big one. I've seen people go to the ER for a reaction to an antibiotic, and their doctor says, "Oh, that's impossible."
It's like a terrible, like, negative, like, reoccurring feedback loop. Like, it's just it And this is why I'm so grateful to have these conversations, because this is what this is about. We got to get the right information out there to people, and they truly have to understand and take ownership of their health, and to know what's out there. And for amazing people like you that are really diving into the root cause, that aren't just prescribing or not asking enough why questions. I think this is important for everyone, and for also other providers that if they might be stuck on something, and hey, this isn't showing up. I done this, that, and the other thing, but I think this person can utilize more help than what I can give, and that's okay. Pass them along
Hmm.
to the right person. And so this is just as important for them to hear, on the clinical side, to also the non-clinical folks that are listening. So I think, both things are important, but and kind of that vein of things, for both people, I think every, you know, I would say field specialty is kind of plagued with, and we talked about this briefly, but misconceptions.
Oh
There's
yeah.
there's, and kind of in the way you made me laugh, and how you thought, what functional medicine was going to be, and who had this and crystals. Like, I think there I think every specialty has some kind of old wives' tale or something associated to it. And I think for everyone, I'd love to know what some of those things have been for you. Maybe they have also surprised you as you have dived into this. But what can you tell people, whether what is functional medicine, or things that you hear on a daily basis, like, oh, I have a patient that just said, like, ChatGPT told me this today, and it made your eyes bulge out of its socket, and you're like, that is
Oh
so
yeah.
that's so
That's
wrong.
probably every single day, that possibly every interaction that I have, I can pick some of that out. But that's the world we live in, you know.
Yeah,
My wife bought me a mug over there that says "Don't confuse your Google search with my medical degree" a long time ago, and I thought
quite
that is arrogant.
saucy.
I'm like, I thought it was arrogant and presumptuous, and I was embarrassed by it. And she wanted me to put it on my desk to put pens in, and I'm thinking, I'm never going to let anyone see that. Now I point to the thing like almost every hour because I am amazed at, and this just shows how much misinformation and confusion. I'm amazed at how much information is out there, and it's all created and treated equally. That's a problem in and of itself. It depends who it's coming from
Yeah,
sometimes, but nowhere near as much as it used to. If we were having this conversation in the 1950s, you did what your doctor said to do, period, end of sentence. There
yeah, no
now I
sense.
can put my life experience, my training, that my area of expertise, my own personal journey through similar healthcare battle. I could put all of that out there, and it's on par with a cursory, 5-minute Google search on someone's computer. So trust, what you started talking about was ego. And doctors hate saying I don't know. It's like they're trained to never say it because they're going to get sued. I love saying I don't know because it's an opportunity for me to learn something. And I like learning. That stimulates me because I can better help somebody. So if somebody says, "Hey, do you know such and such?" I'm not uncomfortable to say I don't know, but I'm going to find out, or I know someone really good who does, who I'm either going to consult with or refer you to. So just being real with people has more of a currency now than ever. Feeling like they're being heard, listened to, respected, not gaslit, not blown off, not rushed. All of the things that all of us know and hate about our doctor, but yet still have to go to a doctor because, like, what's the alternative? That's what I wish people knew. I wish that they could find a different restaurant. I wish they could find a provider that resonates with them. I wish that they could build that rapport and trust so that they don't need to go ask their neighbor's friend's cousin's brother, whose uncle's dog knew a guy. And because that's the biggest challenge is I may make a recommendation. Let's say it has something to do with mercury amalgams. Well, people are going to go naturally to their dentist and say, "Hey, this guy thinks I've got a chronic burden of mercury that's interfering with my body." They're going to get laughed out of there. Then they come back to me. "Yeah, I asked my dentist about that, and he doesn't know about that, or he thinks you're wacky, or whatever it is." Same thing, primary care. Like, "Hey, had you tried diet and exercise or red yeast rice and niacin or whatever before your statin?" Well, no. Have you
N-
tried quitting drinking? Well, no. Well, ask your prescriber, your cardiologist about that. They'll get laughed at. They'll say like, no. I had a professor in medical school that thought we should put statins in the water supply because we all were obese and had crappy diets, and they were so safe. He might have been right about the crappy diets and mostly right
Right.
about the obesity, but so safe, 30% incidence of some of these serious side effects. And people are never told about them. They're not aware about them. Or when they're having them, they're ignored. The doctor denies them. Like, that can't be. And then like you said, it goes on for years. So I like educating people. I like thinking root cause. I like searching for the best way to get an arrow over someone's castle or a crack into this locked vault of this nervous system or this lockdown health pattern. Because a little bit of a pressure point at the right place, pulling on that thread or whatever, releases the whole system and restores it to a natural, healthy state. The same wisdom that knows how to heal when you cut your hand.
You know, it must feel so wonderful when, you're with someone and you finally, they finally have a chance to heal.
It is. It is. It is. It's absolutely wonderful. It's actually, I don't always enjoy my job, but that part of it, when somebody does get it, when somebody gives themselves autonomy and permission to be their own steward of their own health and realize that their primary care, quite frankly, just doesn't really give a crap about them, or they feel it from another provider, that's probably one of the greatest, other than child, when my kids were born or a major accomplishment. It is one of the most rewarding things. It sustains me.
It's something that's, definitely taken for granted, our health. And you know when you don't feel great. And you know when you're not being listened to. And when you go through these maybe chronic things for that person, or they deem it as chronic, it's hard. Like people don't think about what that feels like to be on the other side. And you said, you see it all the time. People come in and this is like their last resort. And I wish it didn't have to be that way, but it's such a blessing that you're here and that you've been able to help people that have been in those really tight spots. Like the brick came through the glass house and it's all over the place. And so
It helped.
yeah,
It helped, and it helped me realize. It helped me. It's almost like one of those pictures at the mall where you stare at it, you stare at it, you stare at it, and all of a sudden it jumps out. It helped jump out at me the design flaw of our healthcare system. And the state of affairs that we're at right now. You've
yeah.
got like this, you've got your left pinky doctor over here, right? And
Mhm.
then you ask them about their right pinky, and they're like, I don't know, I don't do that. Well, could you talk to my right pinky doctor? I'm awful busy. I'll try. And you can't get a hold of them. There's all these subspecialists. A good mechanic, if you brought your car in with three symptoms, would find how all three of those were connected,
Yep.
understand the mechanism, and then treat the root cause. That's
Yep.
not how our healthcare system is currently functioning. We've got the left tire doctor, the radio button doctor and the dome light doctor, and they never talk to each other. And if you got better, who cares? We wouldn't be talking about this right now. But I see the treatment refractory. I see the chronic illness. I see the ones that it's complex. When the biochemical machinery of your body slows down,
Mhm.
you yourself, the terrain of your body is now a giant opportunistic infection. So,
Mhm.
guess what? You get reactivation of viruses, you get different dysbiotic and microbiome changes, you get higher mold burdens, you get a difficulty removing the normal toxins that we're seeing. Now, normal, I put that in giant air quotes, but the amount of toxins that we're all exposed to now, as opposed to 50 years ago, as opposed to 500 years ago, is astronomical. So when that machinery slows down, you can get all kinds of counter effects.
Mhm.
And then you get this sick syndrome. Doctors don't like that. They like a number on a lab that they can treat with a drug.
Cut and
And if
dry.
it doesn't get better,
Yeah. Then what? Yeah. It's an interesting topic. I mean, we could spend the entire time on it. I am sure. But like, I think something that I think to round out today, just because you've given us so much to chew on, I think there's some pro tips for the patient side of things, but then also would love to hear from the provider side of things. I think everyone can learn something today, and I think in both spaces those things are true. And so, what would you say for a patient? Something that they can do today that can move their trajectory forward, their health trajectory forward in a positive direction, but then also is there something that you are doing at the practice today that has been really helpful for you, and that you think, whether it's how you interact with the patient to maybe technology that you're using, whatever it might be, is there something that you're like, man, every provider should be thinking about this, working on this, doing this right now?
Yeah, I mean, I think the pro tip, well, are you talking about a pro tip from a provider or patient or both?
Ooh, let's do both. Let's do
All
both.
right. I would say from the practitioner, it's seriously assess how you're approaching your patients
Yeah.
and why they aren't getting better and look at the number that aren't getting better. Also seriously consider how much of your interventions truly are causing harm and why.
Yeah.
Start asking why. Start really thinking of the body as a terrain, as something that has a lot of moving parts that have to be considered concurrently. You think your doctor is doing this, and I assure you they are not. It shocked me. I went through the same training and I realized, oh, at first it was these people don't think like me. Then it was, oh wow, I see why we are the way that we are. So think globally, think holistically, think exposure, think mind, body, spirit. Look at their trauma, look at their lifestyle. When did we stop asking about that? I never did, but that is crucial from the provider standpoint. From patients, it's realize you are your own healthcare steward. You are the one that makes the calls the shots, recognizes the symptoms, and hires consultants. I don't care if you have a white coat with the freaking that doesn't impress me. You
Yeah.
work for me and I need your help to get well. I need your expertise. I need, your support. And
Yeah.
so find someone that you trust. Think about the things that they never talk to you about. And then think about more importantly, why aren't they talking to you? With
Yeah.
age comes some wisdom. So there's some self-discipline sometimes involved, but I can start with anyone. And that includes thinking about your diet. Observe it. Start by just observing it. How often do I eat? What do I eat? How much do I eat? Where am I getting it from? How do I feel afterwards? What does it do to my body, my skin, my gut, my energy level? You are what you eat. Most people don't realize that. They don't think about that. So just by observing it, you can start to move the needle and shift your perception. Um, Exercise. So you say diet and exercise. Well, I don't say diet exercise. I say conscious eating and movement because diet is like, whatever. Exercise, not going to happen. But conscious movement, and I can tell people, hey, when you get up in the morning, you take a hot shower, it stimulates your adrenals, and that does this. Education is a big piece. So educate yourself. Now, where that's becoming a bit of a challenge, now we've entered the chat GPT world and almost everybody's chat GPT and their symptoms. And I'm disturbed to say chat GPT has already outperformed most of our physicians. I can confidently say that. So it's a good place to start. I think it's better than a Google search. It tends to meta allocate data in a more effective way. You don't remember when the internet came out, but when it first came out, it was very Wikipedia like.
Yeah.
Only people with really, intelligent backgrounds could even post on the internet or have access to the internet or even had computers for that matter. And then the quality internet has sort of gone to hell in a handbasket. So ChatGPT is interestingly bringing that back up, and educate yourself about conditions, educate yourself and be open-minded. So diet, exercise, lifestyle, hydration. Sometimes intermittent fasting can be really helpful. Sometimes waking up and having a little, Celtic sea salt or Himalayan sea salt and cream of tartar or an electrolyte to again boost your adrenals, set the tone for your day. A routine. We're all creatures of habit, structure, accountability, routine, doing the same thing every morning in the same order. Try it, journal, exercise. It will change your life. And it's the beginning of illness. It's also the beginning of healing. So those are a couple pearls, but I would bore you to tears.
No, I think people don't consider the basics. And again, it's one of those little things that we take for granted. And so I like how a lot of these things, let's just take it back a notch. And I love just even the differences between, movement instead of exercise and not diet, but conscious eating. I love
Hmm.
that idea because yes, I think we hear things too and we internalize that, and that's not what we want to do. That's not, the alarm is going off, this foreign thing that I'm afraid of. I don't want to do that. But I think you make it easier to abide by the it takes two to tango model. And help people on their journey, even just by using simply the language that you're saying and the evidence behind it. And I think that, yeah, anyone can just say diet and exercise, but what does that?
Right. Yeah, and how is it heard and received? So I become the shape of the tool that's needed for the job. And if it's, someone's at a pre-contemplative phase, I'm gonna meet them there. I'm gonna say, hey, you know what? Just try it for 30 days or whatever. Just to get them to actually make movement forward because progress, not perfection, is what we're going for. And if you look at the stuff that we eat, what you could reduce, the biggies, dairy, sugar, gluten, whatever. Dairy is not what it was 100 years ago. Now it's full of antibiotics and hormones, and dairy is hugely inflammatory, especially if we're already living in a chronically inflamed state. We've got an acute on chronic insult. Now all
Yeah.
of a sudden we're getting symptoms. Now we're getting allergies. Now we're getting rashes or whatever. Or gluten. Why is there so much gluten insensitivity? Is it real? Is it a fad? Well, 100 years ago, you had, stone ground wheat. Now we've got steel machines that process it, and we've got GMOs, and we've got glyphosate loaded on corn and wheat and all of these products. They make us sick when we're chronically consuming them, and the toxins will build up. And any reduction in our body's defense, whether that's illness, age, genetic, whatever, it creates disease. It launches off of that point, the toxins break through, and now all of a sudden, what you used to be able to eat or drink or breathe will make you sick.
Mm. It's so wild to think about. Yeah, I mean, if you really break down everything that we're doing on a day-to-day basis, how much of that is causing us a lot of internal harm. It's more than you can count on two hands, for sure. But Mark, this has been incredible. We could have, I think, six different branch off segments of all the different questions and ideas that we've come up with here today. But in case people want to find out more, want to see you, want to see folks that are on your team, where can they best? This is like the shout out time, Mark. So where can folks come, whether website, social, what are some resources for people that they can reach you?
Well, if you're in the Florida area, our local practice is on the Gulf Coast, Sarasota area. So Mind Body Medicine of Florida, or mbmfl.com. I think you'll have that in the description. Or if you're just nationwide and you're looking for a health coach, which would be the long-term equivalent of a primary care knowledge. I'm a doctor. I would not be your doctor, but I can offer health coaching advice that you can bring to your local provider. That could be anywhere in the country, and that's a program we have within MBM that's a national online coaching program called Vesta Chelation Method, which is vestadetox.com. I have plenty more websites and things that I'm interested, because, like you said, it's the why that keeps me talking and interested in constantly learning more. But we have a great supplement company, Infusion Supplements, at infusion.net, not .com, where we offer a lot of specialty chelation products, very difficult to find and source products, which stemmed out of the pandemic because we were unable to get dechelators and a lot of things people haven't even heard of yet, Emeramide, OSR, BDTH2. So those can all be found on that website. And yeah, we're on all the social medias, the Facebooks and the TikToks and the Tweeters.
That is perfect. And yes, for everyone here, go visit any one of those resources. We will link them here. But Mark, this is amazing. We so appreciate all of your time, all of your insight and perspective. Super important in this day and age. And I know that everyone has enjoyed this very much, and we hope to have you on again very soon.
Thank you so much, Rachel. This has been a blast.
Same. Thanks, Mark.